You know, they're improving smiles every day over at the Aesthetic Associates, and Dr. Shatkin has other doctors with him who understand mini implants just as well. John Lucchese is back with us. Dr. John, you have been on for quite a while now, and you brought some very special people with you today.
Yes, I have. Thank you very much, Linda. Good morning. My father practiced 92 years old, Dr. John Lucchese Sr., practiced for 50 years. And I had my lovely dental assistant 10 years ago. She practiced with me for 19 years, and she's been retired for a little bit. And her lovely husband, Al, been a patient of mine for 35 years.
Wow.
And they all have mini implants.
They all have mini implants.
For the last 5 years, over 5 years now.
Wow. And now, doctor, let me ask you, because obviously the mini implants came along as you were already, you know, practicing for a long time. What do you think of these mini implants?
Well, I think they're terrific. I tell you, you could really chew and eat everything you want, and they're great. They're great for you. I tell you, people are living so much longer.
Yes.
That they're going to need them.
Yeah. Fantastic. So let's look at some of the pictures that you brought too, and we can find out how the mini implant actually improved a situation that looked kind of dicey there.
Correct. That's my mom had a fractured root in the upper teeth, and my father brought her in 5 years ago, and I said, geez, Dad, we're going to have to remove it. Bone graft, it wait 3 or 4 months, put a larger implant in, conventional implant in, wait another 3 or 4 months. And then we'll put the crown on. And he goes, well, why don't you just do the mini implants? I said, okay. I said, you know what, I didn't think about it. Until 5 years ago, I was working with Dr. Todd Shatkin at the Aesthetic Associate Center. I timed it. We ended up taking the roots out of my mom and the pieces, and we put a mini implant in, and I retrofit the crown on over it. And 2 days later,
oh my goodness,
you could still see the puncture marks where we did the anesthesia. And then 5 years later, she still has the tooth and still eating.
Wow,
fantastic.
Fantastic.
And she's 91 right now.
She's 91. Yes. You see, it's never too late. Never too late to have your beautiful smile and to be able to enjoy food. Now, Carol, you've been in from the beginning watching these implants come into play. When did you realize that was a good idea for you?
As soon as I heard about it, I told John I need mini implants.
And how many did you get?
Well, we restored the upper teeth. We did a combination with the implants and some of her natural teeth. Over the years, you know, she started, having tough time with the teeth, and we were able to replace them with the mini implants. We did her whole upper bridge for her.
Wow.
Right.
And how long did you work with Dr. John?
19 years.
19 years. So you knew he was a good guy.
Good dentist. He's the best dentist in the world.
Yeah, second generation good dentist. And Al, then she told you, this might be a good idea for you, right?
Yes.
And tell me what you had done.
I had a lot of work done and other work, but for 35 years, it's been painless dentistry.
I love it.
That's the point.
Nothing like a happy patient, right? And that's what it's all about. We have so many people who just refuse to make that move because they think it's going to be painful and it's going to be a long, lengthy process.
Correct.
And it's not.
No,
well, that's
it's not.
The painless dentist, I call them.
He's the best. He's the
He's
best.
a good dentist.
Thank you. And for Dr. John Sr., you did a good job with Junior.
That's right.
Yeah. Dr. John Lucchese is over at the Aesthetic Associates. Happy patients. Think about the implants. Think about your situation. They may work for you. We're talking about mini implants. And it certainly has been an answer for these folks for many years. Mini implants. Give them a call at the Aesthetic Associates Center at 839-1700 or simply log on to great8look.com and you'll be smiling pretty too as we start to head into fall.